5 overlooked body parts that affect your long-term health. Most of us follow the same hygiene routine we've had for decades: showering, brushing our teeth, maybe applying some lotion, and we assume that's enough. But according to geriatric specialist Dr. Emma Harris, who spent over 30 years working with older adults, there are several commonly neglected parts of the body that can quietly lead to inflammation, infections, weakened immunity, and even complications tied to heart disease, diabetes, and cognitive decline. The good news? Fixing this takes just minutes a day. Let's start with your tongue. At any given moment, it hosts over 700 types of microorganisms. Left uncleaned, bacteria can slip into your bloodstream through tiny cuts or inflamed gums, a risk that grows as we age. Poor tongue hygiene has been linked to heart disease, diabetes complications, respiratory infections, a dulled sense of taste, weaker immunity, and chronic bad breath. The fix is simple. Use a tongue scraper, an inexpensive tool you can find at any drugstore. Gently scrape from back to front, 3 or 4 passes, then rinse with water or an antibacterial mouthwash. Do it in the morning before breakfast to clear away overnight buildup, and again at night with a lighter touch, since your tongue is more sensitive by then. The payoff is real. People who start this habit often notice sharper taste, less strain on their immune system, and fresher breath. One 67-year-old was stunned by how much better her food tasted after just a few weeks. A 71-year-old who'd battled bad breath for years despite brushing and flossing religiously saw it disappear within 2 weeks of scraping his tongue. If you ever notice persistent soreness, white patches, or discoloration though, that's worth a trip to the doctor. Next, your feet. Each one contains 26 bones, 33 joints, and over 100 muscles, tendons, and ligaments. As we age, circulation naturally slows down, so your feet are often the first place warning signs show up: swelling, cold toes, redness, or burning sensations that might point to nerve damage. For anyone with diabetes, proper foot care isn't optional. It's what stands between you and ulcers or infections. Wash your feet daily with a soft washcloth and mild soap, paying close attention to the spaces between your toes where fungus loves to hide. Use warm, not hot water, and don't rush. Sit down if that makes it easier. But washing is only half the job. Drying matters just as much. Use a dedicated towel. Dry every part thoroughly, especially between the toes, lifting each one to dab gently rather than rubbing. Leftover moisture is exactly what fungal infections need to take hold. Once your feet are completely dry, moisturize the tops and soles, but never between the toes, where trapped moisture can undo all that work. Make a habit of checking your feet daily for discoloration, redness, cuts that won't heal, swelling, or tingling. These can be early signs of circulation or nerve problems. One 73-year-old learned this the hard way. Years of just rinsing his feet in the shower led to a fungal infection between his toes. Once he started drying them properly every night, the infection cleared up within weeks, and his balance and comfort while walking improved too. Then there are your armpits. Most people think of them as just a spot for deodorant, but they house more than 20 lymph nodes responsible for filtering toxins and supporting your immune system. Sweat, bacteria, and leftover deodorant or antiperspirant can build up, clog pores, and lead to irritation, odor, or even painful abscesses if ignored. Wash with warm water to open your pores, using a soft washcloth and gentle circular up and down and side-to-side motions. Choose a mild, fragrance-free soap and rinse until every trace is gone. Afterward, pat dry gently with a dedicated towel and let your skin air out for a moment before applying deodorant. Stick with this for even a week and you'll likely notice smoother skin, less irritation, and less odor. One 65-year-old dealt with recurring underarm rashes for years before switching to unscented soap and rinsing more thoroughly. The difference, she said, was night and day. Your nose deserves attention too. We take about 20,000 breaths a day, and the nose is one of the body's most effective natural filters, screening out dust, allergens, and bacteria before they reach your lungs. Neglect it, and irritants build up, leading to inflammation, stuffiness, snoring, poor sleep, and even reduced oxygen flow to your brain. Start your day with a quick nasal rinse using warm water or use a saline spray. Think of it as a refreshing shower for your nose. A neti pot can go even deeper if you deal with congestion or seasonal allergies. Steam helps too, whether from a warm shower or a bowl of hot water, and a few drops of eucalyptus or peppermint oil can make it even more effective. When you blow your nose, do one nostril at a time into a soft tissue instead of forcing both. Blowing. When you blow your nose, do one nostril at a time into a soft tissue instead of forcing both. Blowing too hard can push mucus deeper into your sinuses. If your nose tends to dry out, a small dab of coconut oil or vitamin E can keep things comfortable. The payoff shows up fast. Clearer breathing, deeper sleep, fewer allergy flare-ups, and noticeably more energy. A 69-year-old former construction worker had assumed his chronic congestion was just part of getting older until a simple saline routine changed that completely. A 76-year-old gardener said she used to wake up feeling like her head was stuffed with cotton until she made nasal care part of her daily habit and started waking up refreshed instead. Finally, your belly button. It's easy to overlook, but sweat, lint, and dead skin can accumulate there, sometimes causing a persistent odor. As we age, hormonal shifts, medications, and slower skin cell turnover can make this more noticeable than it used to be. A gentle, regular clean as part of your normal shower routine is usually enough. If you have a pierced belly button, keep in mind the piercing hole never fully closes, so continue cleaning around the jewelry with warm water and mild soap and dry it completely afterward. Watch for persistent redness, unusual discharge or itching, or ongoing pain, especially if you have an old piercing or if you're managing diabetes or a weakened immune system, since small infections can escalate quickly. 5 small, easy-to-overlook areas: your tongue, feet, armpits, nose, and belly button. And yet paying just a little more attention to each one can lower your risk of infection, improve circulation and immune health, and leave you feeling fresher and more energized every single day. 5 small habits, 5 parts of the body most of us never think twice about, and yet a little extra attention to each one can mean fewer infections, better circulation, steadier energy, and a body that's working with you instead of against you. So here's my question for you. Which of these 5 did you not know about until today? Let me know in the comments. I read every one. If this video gave you something useful, do me a favor and hit like. It really helps this reach more people. who could use it. And if you want more simple, science-backed ways to feel better and stay healthier as you age, subscribe and turn on notifications so you don't miss the next one. Take care of yourself. I'll see you in the next video.